So I would like to welcome everyone to this episode of the System Podcast. And today we have a special guest, in person of Professor Isah Sadiq, who is also known as Baba Isah. He's an experienced consultant with a demonstrated history of working in the medical practice industry. He's skilled in epidemiology, program evaluation, public speaking, program development, and global health. And he's also a strong consulting professional, graduated from ABU's area and with additional qualification from the University of Sheffield. So I would like to formally welcome him to the program, sir.
Thank you very much.
Yeah. Now, today's episode, it's kind of like we'll be covering some particular thing. And the first segment is on the JAPA syndrome, which we all know is one of the things which bothering our nation and people entirely. So, sir, first of all, we would like you to kind of, with your experience, briefly explain to us what this concept means and the concept of the healthcare professionals.
Okay, this is a concept that is unique to Nigeria. The young persons have a way of bringing in new words into the vocabularies of different languages. And in Nigeria in particular, we have come to terms with the new terminology that is called JAPA syndrome. That is, I'm sure it's from one of the Nigerian languages, and people have now adopted it to mean leaving the country for greener pastures. This permeates across different sectors of our economy, but it is very, very clear in the health sector that many of our young medical doctors, dentists, nurses, and other health professionals want to leave the shores of the country to especially Western countries and Arabian countries, depending on where the people are from, which part of Nigeria they are from. So you find out that many of our young graduates, including young specialists who are not heavily burdened by families, they tend to leave the country to places like UK, the United States of America, Canada, Saudi Arabia, and recently to places like Qatar. These are the countries that take majority of our people away. So in a nutshell, that's what we can consider as JAPA syndrome.
Okay, thank you very much, sir, for the precise clarification of this concept. Now, sir, you've called some couple of countries for us, which most of our professionals used to go to. So, is there any unique thing or maybe an ease which they are having that is enabling them to get those particular countries you highlighted?
Well, a syndrome like JAPA has pull and push factors. So the push factors have to do with the situation of our own country. Nigeria is now facing a lot of insecurity. And then health workers are not immune to the insecurity that is affecting everybody. So there are people who feel that they cannot live with it. It is better if they have an alternative to run away from the insecurity situation. Secondly, the economic situation in our country. Now we are in a situation where our currency has been devalued significantly. Everybody is suffering the untold hardships. Things that you can buy with few amount of naira in the past, now you cannot afford them. So many people will want to go away to face a better situation economically. And then this mainly the push factors that are pushing people out of the country. But of course, another one is lack of job satisfaction. There are people who have specialized in certain areas of clinical medicine and they will want to practice maximally, but then the lack of resources or the technology is not so much available where they are. And if they want to be satisfied, some have to move out of the country to go to where they have such technologies and technical know-how so that they can apply their maximal potential. So that is one of the push factors also. And then the pull factors, of course, better pay. Some people, if they go out of the country, they can earn 10 times what they are earning in Nigeria within a certain period, maybe a month or a year. So that attracts a lot of people, because when you see that you are earning much more than you are earning in back home, you will want to move out, and then you tend to stay there. And some people like to enjoy life. They live in better houses. They experience the working conditions in those countries. For example, they don't have to bother themselves about fuel scarcity.
Yes.
And then they don't have to bother themselves to say that they must own a car, because the system is working. You can rely on the public system. The buses are working, the trains are working, the trams in town are working, and you can predict how much time will take you to your place of work. So you work towards it. You know when to leave home, when you will arrive in your workplace. You are productive. You know when to come back home. Everything is working for you. You don't have to bother about electricity, whether there is electricity or not. You don't have to bother about how much you pay, because the system is working. You know that if the electricity companies charge you certain amounts, it is what you exactly consume. Nobody will overcharge you or exploit you.
Yes.
And then you don't have to bother yourself about internet facilities not working. Everything that should help you to enjoy life, to be productive, is working out there. So these things attract people to move out. And then the job satisfaction, you have the technology working for you. And so all these factors help to push people and to pull them to certain countries where things are working well.
Yes, sir. Okay. Thank you very much for that, sir. Now, sir, in that you have tell us so much good reasons and like why people have to explore outside, and these are very great reasons. Please, we would like you to help us clarify how easy it is for final year medical student who is maybe in 5 or 6 now, looking forward to finish and quickly have a way to plan his way to a better place. What are the easy routes and ways that student can start from now?
No, actually, students are different. Like even during our days, there were people interested in moving out. So they were really tenacious. They persisted in looking for different opportunities, and they were going for the opportunities. Some of us were not so much interested in doing that, and we didn't look for it. So even now, if a person that is his or her interest, they can look towards people who have succeeded in going out among their seniors, and they are guided by that. And even among those that are here, some have a lot of information. So if the students come together to be exchanging ideas and then helping one another, they may find places that are really accepting people coming in. So, and they put action to their words and interests. You find out that they may succeed, but there are a lot of opportunities out there. Those countries are looking for our people to come and work for them. And since the situation in the country is not welcoming, like health workers are not getting the pay they are supposed to get.
Yes, sir.
And so those countries are willing to accept them. They apply, they find out that some of them succeed.
Yeah. Thank you, sir. Now, sir, how does the immigration of these healthcare professionals affect our local healthcare system?
Of course, this is a country that has a large population. And if you look at our indices, they are not looking good. Human resources for health indices are not good because we have not yet satisfied the doctor-patient ratio, pharmacist-patient ratio, nurse-patient ratio, midwife-patient ratio, and all other health workers. The ratio we need, we have not met it. And in fact, it is worse in certain part of the country, like the northern part is more disadvantaged. Yet the number of health professionals we are producing is not able to cover that gap. And still, those who are even available in the country, many of them are moving out in large numbers. So that is further depleting the number we already have, which is not enough. And of course, it is affecting our health system negatively, despite the fact that we are producing more. When you lose, especially someone that has been well trained up to the level of consultant, the minimum number of years you can replace the person is 6 years. And of course, it's not easy with this economic hardship that is making the residency training even more difficult, less attractive to doctors. So, of course, the whole picture is gloomy because we are losing people that should ordinarily be serving our people, and to replace them, it is very difficult. So, the health system is the one suffering most, and I cannot see a solution to this because even if you are the one, when you go out and you earn what your friends are earning, 10 times it, you will not look back. Then definitely the country is losing, and unless the government does something drastic, we will continue to suffer. The few of us that are behind, we will just be doing more than 10 people's job at a time.
Yes.
And of course, everybody has elastic limit.
Yes.
There's limits that you cannot go beyond. So definitely that work that is left undone will be left there, and people will be the ones suffering. And in all aspects, in the aspect of training more health workers, in the aspect of service provision, in the aspects of research, and in the aspects of community service, we are losing. And the tempo is getting low and low. And of course, it's the country that is suffering it.
So, sir, I don't know if you can give us briefly your personal experience or observation regarding this JAPA of it. If you have a personal experience that maybe you've kind of gone to one country and do some this thing.
No, actually, I was in US for a research collaboration to Ohio University, and I've seen the situation there. I mean, everything that should work is working. And been to Sheffield in the UK for the purpose of studies, and then I used to visit London School of Hygiene and Tropical Medicine, and I've seen a lot. And of course, through research collaborations, we've gone to different countries like Egypt, India. I was there as a patient again, and then as a research collaborator. I've been to Sudan, even Ghana, and other West African countries. Anyway, so one can say that countries in West Africa actually were backward. But all those other advanced countries, definitely you'll see things that are working. And of course, anybody who will have the chance to be there, even if it is for some times, including India. I mean, where I was a patient in a private health facility, you'll see that the situation is different. And of course, you'll not be surprised to see the number of young graduates that keep going to the embassies, seeking visas to travel to those countries. And then some of our residents that we are training who just abandoned the residency training program in large numbers. In fact, some of them, immediately they finish their final fellowship exam, they don't even wait. They just leave the country. So definitely it's something that is terrible. And of course, it's telling on our country, honestly.
So, finally, before we end this, I don't know if you have an advice that you can give to we the young upcoming maybe medical doctors also in the future who are to some extent considering this immigration within this stage about stuff that
Okay. So my advice to the young generation is that it is not a one-way thing that situation is bad here. The only solution is to JAPA, because people are looking towards the JAPA thing as the solution. If you go, it's all rosy there. It is not, because there is the other side of it. For example, when I say things are working there, even the rules and regulations guiding our practices, they are really working. So if one wants to live there, he or she must ensure that he or she will practice medicine to the best of his or her ability, abiding by all regulations. There is no issue of negligence or taking the lackadaisical attitude of work that people use here. People will not escape being, brought to book if they misbehave. So one should know that. And then it is better when you are well armed. For example, if you are a specialist, when you travel out, you will be more valued than if you just go as a medical officer. So it is best if one is trained, at least you have certain skills to offer. You will be more valued rather than going as a medical officer and they are using you for donkey years, only for you to realize after like 15 years or 20 years that you are not maximally getting the satisfaction and you will want to now come and specialize. So at that stage, when you are the children who are the age of doctors who are practicing or who are trying to specialize are the age mates of your children, then you now want to come and specialize. You find it difficult.
Yes.
So one has to calculate all this. And then, of course, you have your responsibilities to your families here, your parents, your other relatives that are benefiting from your being a doctor. That's another thing you consider, because you can be in the best places in US and then your parents here are old, they need your assistance, you are not there.
Yes.
So you have to be making phone calls to friends to assist you, and some are not going to be as committed as if you are the one there. So definitely you have to consider all this. Maybe after putting everything into consideration, you will see that the best way is still to go out or to stay for some time. You have to balance everything before you take a final decision. But I can't say that JAPA is the best for everybody. It is the best for some, and staying behind is the best for some. Definitely, we can't all leave the country and we can't only stay behind, because going out in itself has its advantages, apart from the personal advantage, even for the country. Let me just give you an example with India. There was a time that many of them, of their health professionals, moved out to the more developed countries. But after several years, they decided to come back to their country. So as at that time, they have acquired a lot of skills which they wouldn't have acquired if they had not gone out. They got a lot of technology back home, and now they are using it for the benefits of their people. And India is one of the best places you can now go to get medical treatment. So be it in every field of medicine. Okay. India is well developed and they are doing it at a cheaper rate than US, UK, Canada. And that's why a lot of people leave this part of the world to India for treatment, and they get the satisfaction, and the Indians are getting the cash.
Yes.
And it is working for everybody.
Yes.
So hopefully, all those people or some who have JAPA, if they come back, they will come and develop our own healthcare system better also, and then the country will be the better for it.
Yes, sir. Master, thank you very much for your time. This short segment that we talk about the concepts regarding the JAPA syndrome.
Thank you. Very good.
We hope to have you maybe in the future, although you are very busy, sir.